Kael had a serious heart condition. He had valvular stenosis. We were back home in Guatemala in the ICU. But they didn't have the resources enough to do what needed to be done. There's a representative of Health City in Guatemala and Central America. She's actually from Guatemala. She heard about our case and she contacted us. And she told us there's this amazing hospital in the Cayman Islands. It comes from a big chain of hospitals in India, and they have amazing doctors with a lot of experience, and they basically are offering help to do the procedure on our baby.
So I told the doctor, okay, definitely we can help this child. Try to bring him at the earliest to Health City, because child may not survive for long with this condition if you don't address at the appropriate time. It's like maybe few hours, nobody can say, few hours or maybe couple of days maximum. Because when we did the echocardiogram, the baby's pumping was around 15 to 20%. So, and one valve was very tightly narrowed with high gradient, other valve was leaking both on the left side. So with that situation and this pumping, this blood pressure, all because of this lot of medicines to support, that won't go on for few more hours or maybe 1 or 2 days.
We also had to do a specialized test called MRI or magnetic resonance imaging, because we wanted to see the heart wall, how it is like, because that can have a bearing on the success of the surgery.
And it was a very, very severe aortic stenosis. It's called critical aortic stenosis, where the valve on the left side of the heart is very tight and there is hardly any blood going into the whole body.
We are very thankful to our whole team, consisted of pediatric cardiologists, anesthesiologists, perfusionists, nursing staff, physiotherapists, mainly the nursing staff, all work together for one goal, to save this baby.
So this hospital and our ICU is quite well equipped that way to handle all complex pediatric work. And even our staff, from doctors to nurses, physiotherapists, dietitians, cardiac surgeons, we are there 24 hours round the clock. So we can anticipate problems and treat them before we have a complication.
Since it's a very small baby, a perfusionist is a person who controls the heart-lung machine. That is, we are doing the function of heart and lung during the open heart surgeries.
So it was a challenge for us to take care of a baby with less body weight on down ventilator. So we did it very well, and the baby was in the ICU for at least 7 to 8 days, and our facility, fantastic.
It took more than 3 to 4 days to come out from the respiratory issues and stabilized. Now he's doing well, and we are very happy about that.
It's not a permanent surgery, it's not the cure. Now this is a kind of palliative surgery. It gives a few years for us by the time the child will grow, and then we can do the definitive surgery. So far we have done nearly 200 surgeries in 2.5 years with excellent results, all because of our team.
So we were going to the States. Actually, before looking here, we're already looking to go to several hospitals in the US. When they send the quotations, it was very overwhelming. We got very worried because, we had to save his life, but money was a big deal, So this is another main reason we came here, because doing the numbers, it was 10 times less to come here than to go to the States. So this was another major factor, and they were making here everything much easier to come here than to go to the States, paying a lot more money, 10 times more. So everything was way easier here, definitely.
And more human.
And more human, definitely more human.
Saving a life is more important than this putting price on lives.
He had very little chance of life, and suddenly the light appears, and they call us from here and tell us to come. They know what to do, and we come, and a month after, here we are, happy, and here he is with us. You know, it's a miracle.